Tinakwe, hello. I have the honour of representing Judy Clements today, who is away on sabbatical. So now I'm on the clock. My colleagues need to have their time, so I'm hoping I won't start out like a race commentator, and hopefully just keep it measured. So as Annette said, my interest has been around citizenship and those ideas in terms of working with my research around working with service users. But today the topic is around social inclusion. I actually don't have an answer to that, but I wondered if we can draw some parallels with the presentation and see if there are some parallels. Okay. So firstly, I'm addressing you as citizens. I think it's a concept we often take for granted, and certainly for people who have serious mental illness, they say that they have conditions on their citizenship. So just in case you need to know, this is what it means for us. It gives us a status. It means that we have a set of rights, virtues. We have to kind of work within the rules and norms of society. We also have some, in return for that, we get the social rights, we get the equality. Those are the notions I think that are important when we're talking about belonging and what we belong to, is that citizenship is often the abstract concept that actually brings that together for us. So why is it important? Firstly, it gives us a status and a practice, and we know that people, when they're discriminated against, lose their status often. It means we have sovereignty over ourselves, as well as the protection by the sovereign, by the state. And it also means, I think, which is really important, the idea that when we participate in a group, we get some cash in the bank, which means we get some symbolic status, some economic status, and some social status. And also that underpin that, and I think hopefully as the take-home message from my session, is that it's underpinned by this sense of personal agency or personal power. So therefore, what might be the connection between the two? We have a sense of the extent to which we are all included or excluded. We have a certain set of rules and norms that we find that we have to navigate or manage. The degree to which we can exercise our rights and responsibilities. Also, this idea about the thickness or the thinness of belonging, what it means to be part of a collective and the bonds that we have with other people. And it also relates to the idea that we are living within an environment where the state borders and certainly our homeland security has increased considerably, and therefore, obviously, sometimes the more we increase the safety of citizens, we actually restrict their liberty. So things have changed. Things are not sacrosanct anymore. We're not in Kansas anymore. We now have, recently in New Zealand, we passed the GCSB bill, which means that we're all under scrutiny. And that also, as citizens, for those who are vulnerable and troubled, it means that often the state can put into place these technologies which actually manage troublesome populations. So, and also the other thing is the current political backdrop. We are within a system that currently works from a neoliberal perspective in terms of healthcare. There's a commodification of healthcare. There's also the idea that care can be bought. It's a business model. Thanks to Mrs. Thatcher. It also means that there's a pressure upon individuals to take responsibility for their illnesses, which tends to sideline public problems to become private troubles. There's also the politics of fear. We know we're on the eve of 9/11 tomorrow. I think it's 13 years since that happened. It's certainly still having its ramifications around the world. We're on the tail end of the global financial crisis. We know that in Italy and the other countries, the PIG countries, the suicide rate increased considerably amongst people who had no contact with mental health services or had no known mental health conditions. We're also aware of this idea that when those things come together, it's like a perfect storm in a way, that people lose agency, or their agency, their personal power collapses. And part of that is then people become othered, become different, we become suspicious of people, we exclude people, and the consequences on their health is unimaginable. Now, I work within mental health, I work with clinicians, I work clinically, and sometimes I think we're a bit like the fish in the water. We don't actually see the water. Mental health clinicians are still rating quite highly on the most discriminating groups that service users in this country talk about. And I think it's a good reminder of us about what stigma is and what the steps are. Firstly, we find a difference, then we label it. I'm talking about negative stigma here. Then we make the stereotypes. The word stereotypes was used before by our speaker just after lunch. Then we separate people off. We make them different from us. We separate them. We then, the person loses their status. So if you think about that power and that personal agency, that disappears. And then there's a sense of discrimination about what we do to further exclude people. And often that might be dehumanizing as well. And there's lots of examples in history where we've done that with groups of oppressed people. And of course, stigma will only happen when it's in the final stage in a power situation where we take the power away from people. We think about those disenfranchised groups who lose those civil, social, and economic power. And of course, we're in an environment which is underpinned by often those invisible discriminatory beliefs and practices, which is ageism, racism, homophobia, and interestingly, sainism, which is about how this kind of almost invisible sense that if anything's wrong with somebody, then they must be mad in some way. So therefore, the collapse of agency can result or perpetuate in mental health, physical health, ill health, and distress. We know that people get unwell. And also, we can't underestimate the power of self-stigma, about the shame and demoralization associated with being labelled mentally ill. And I also know that from personal experience of being bereaved by suicide, that also there's that internal stigma that you have as well as a family member. So on a brighter note, this was really good to do a research project which actually went out and asked what was right in the world rather than what was wrong in the world. And we spoke to a large number of people in New Zealand. So I'm just giving you a sneak preview. This research report is in preparation for publication. So we looked at what the stories of success are for people. About 53 people overall, a mixture of focus groups and also individuals, to talk about what was working for them. And I don't know if there'll be any surprises here, but what was the bottom line for them was that it took one person or one event to actually increase my sense of social inclusion. And that's all of us here, isn't it, in terms of being champions for people. That was the word that they used, the champions. And that was by celebrating, accepting people's difference, and therefore they didn't have to disavow their difference in order to be included. Making it safe to disclose, being open and honest, and maybe that has some parallels around talking about suicidality. Instilling hope, that affirmation and reminding people about their rights. Again, it links back to that sense of personal agency and having some power and control over your life. Recognizing people's contributions, that we are all positive role models for people. Expecting and also encouraging people to be leaders, to take their place either in research, in teaching, or in education, or also in the workforce. The restoration of the power, feeling that power coming back again, but also conveying those important messages about I'm important and that I matter. And I'm thinking about our recent speaker who said that the people on the trial suddenly felt a sense of connection and belonging because somebody was paying attention to them during the drug trial. It's often a very simple step, isn't it? So therefore, what we found, some of the early findings were that the idea of the circuit breakers comes from Debbie Peterson's work with her co-colleagues there around looking at self-stigma. And that the main thing was that people said once they got their power back, they felt that inclusion just happened and that they could then include themselves as well as other people around, including them. Increasing people's participation, remember that actually progresses our human capital, things that we take for granted. It deepened their sense of belonging, and also the reciprocity principle was also really important about being able to give and take. And I think the reciprocity principle is something that's very important in terms of mental health law, that if we're going to be depriving people of their liberty under the Mental Health Act, we need to give them something back in resources. And so therefore the idea today, I guess, is looking at how are we going, and do we need to kind of shift the lens and change the paradigm a little bit about the future and what that might look like. The symbolism there is definitely we need to start with the young. That was definitely something that came through in our social inclusion research, that young people need to be able to have an active role in shifting the way society thinks about difference, moving away from stigma discrimination as a health issue rather than it being a rights-based issue. That it needs to be a rights-based issue, rather than seeing it as a medical or a kind of a health issue. And I think that's the public health message that came across in that first speaker after lunch around we need to be able to look at what society does in terms of supporting and guiding people who are vulnerable and troubled two very important documents there, the UNCROC, which is the rights of the child, and the UNCRPD, which is the rights of people with disabilities. The rest of the world is watching New Zealand. We have to report, I think, every 2 years about whether we're increasing participation and inclusion amongst our people that we serve. The use of the law, Israel has just announced, finally, I think the first country maybe, that there's a law now within cyberspace. I think that's the final frontier of bullying, stigma and discrimination, which I think links to the higher suicide rates. We've had the idea that in Israel now, if somebody defames, then the ISP is actually, under law, has to give the name of the person, the anonymous person that posted that email or that blog. And the hate speech law, and also about improving people's life chances. In the UK, for instance, people get individual budgets to buy their care with, and of course, multi-level sector. So how, closing statements around our respectful treatment of vulnerable and troubled in society. So it's about, as a society, how can we maintain the dignity of people who are different, or deemed as the outsiders, and at the same time, in a risk-averse world and a risk-averse mental health system, uphold the safety of the public. As clinicians, again, I think, how do we manage our own moral distress, and how do we manage our own collapse of personal agency, often in unrelenting workforce environments where there is a sense of, which is what Deegan talks about spirit breaking. And also this idea, there's more of a sociological view about participatory imagination. This is the work of Martha Nussbaum, who some of you may be familiar with, that we, rather than seeing the stereotype, we see the full human being, and therefore we don't exclude or other people. Thank you.